Our attention back to South Africa, and we'll pick up that interview that we were having. The National Education, Health and Allied Workers, that's Nehawu, say healthcare workers in the country are eagerly awaiting the start of the inoculation process. So talking to us here, we've got Zola Saphetha, who is the General Secretary of Nehawu. Zola, I hope that connection is all good and you can hear us again. Good morning. Thanks again for joining us.
Okay, thank you.
Zola, so the question that I was asking you just before we got cut off was in terms of when the Johnson & Johnson vaccine is arriving. If you have any more information about that. We were told this week sometime, perhaps tomorrow, and then of course we've got to wait a little bit and then the vaccination process will start. Do you have any more details?
Certainly we are aware of the fact that the flight left Belgium late last night, in fact early last night to South Africa, expecting it to arrive by any time this morning, and then it had to be fetched and be processed through procedures, and then expecting that by later Thursday to Friday people will be vaccinated with Johnson & Johnson, which has been proven to be working even in the variant 501 YV2, which is confronting South Africans. So hopefully the rollout will be starting this week. Take into account that this will not necessarily be regarded as a rollout, given the minimal number that we have secured, which is 300,000, which is going to come in trenches. Now we're expecting to receive 80,000, and 80,000 in 2 weeks, and another 80,000 next the following week, up to 60,000, so that we get the 300,000.
So that's okay. So that's where we're starting, and many are still saying, obviously, that these doses will actually be a part of an ongoing trial. I mean, obviously, it's not necessarily still a trial, but it is the finishing stages of it. Is that your understanding as well?
Our understanding is that we have passed the trial because it has been tested to about 6,576 people here in South Africa, and it has been also tested in the 4 continents, including Latin America and the US. But what is going to be happening, because currently there's no license for the use of this vaccine, so it would have been rolled out in a manner that is respect that while authorities are to grant a license, because it has been proven to be working. And it would be unethical to keep what we know all of us as working on the basis of the license. So while following the processes of licensing, we must be vaccinating people, because as you will know, Leon, that to date is about 40,000 healthcare workers who contracted this disease, and we have lost 663.
Yeah, and that is a detrimental damage to the healthcare sector, which the healthcare workers are already strained, and we know that and we see that. So to lose colleagues and any healthcare worker is really a devastating thing that can happen. So the sooner they get vaccinated, the better, or protected in some way. There is obviously a bit of concern from healthcare workers, and there are some that are saying they do not want this vaccine. Let's talk to your members and their concerns. What is the consensus amongst them? I mean, are you finding that there are more excited to receive the vaccine, or are there a lot that are very, very nervous?
Generally, what we have picked up is that every healthcare worker is looking forward to any form of protection, but they get confused by these deliberate and conscious distortions that to a great extent is led by health experts themselves, which now makes them to be giving doubt to healthcare workers. So December and January, as this we have been on the ground, have been busy educating and empowering our members about the importance of a vaccine in the context of this global virus that we are confronted with. And then therefore they were looking forward, particularly as we were preparing for AstraZeneca, but they got disappointed with an announcement. But also we went back to them to say that it was a necessary thing for government to be transparent, so that government doesn't keep quiet and allow us to get into this process and then later come and say these things amidst these distortions. For instance, others, they are told that earlier on, if they can be vaccinated, they can be guinea pigs and so forth. So we've been just clarifying that certainly that is not the truth. And but also clarifying to them that what is the vaccine all about, because among the perception was that if you can be vaccinated, it means you would have prevented yourself from contracting the disease. Others, they thought that is a cure. And then we clarified that the vaccine just strengthens your soldiers to prepare for a war. In case such a virus comes to your body, it can fight back.
Yeah. I mean, if we sort of take a look at what happened in terms of the AstraZeneca vaccine, and there was meant to be this rollout, and then of course it was seen that it didn't, and this is a bit of a roller coaster ride for everybody at the moment, and we know how science works, and that is just the way we've been told that things do happen, and it's rather that we want the maximum protection as opposed to something that it is not going to be a better way. Now, one of the concerns as well is whether or not healthcare workers are going to be forced to have this, or it is going to be, dependent on whether or not they want to take it. From the union's perspective, do you feel that there is a lot of pressure on healthcare workers that they have to have a vaccine?
There is, Leanne, there's a lot of pressure, because we're observing them contracting the virus, we have seen them dying, we have seen them being hospitalized, we have seen the strain. And the only option for them to be protected and also to be taken out of trauma is when they are vaccinated, because this vaccine, AD26 COVID-2, that is coming from Johnson & Johnson, has been proven to be working. It's 100% protection in terms of death. Is 85% for protection for severe COVID, and this moderate to severe COVID-19 impact is 57% protection. So there's no reason to doubt. It has been scientifically proven, and it's something that must be taken, and we'll have to encourage. If it was about us, we would have made it compulsory, but because we're in South Africa, the rights of individuals are respected. That's why it's not imposed, but it's voluntary, and also is at the discretion of an individual. But our program as Nehawu is more encouraging all of them to get into this, to be vaccinated, because that's how they're going to have their immunity strong, and also that immunity will contribute to the overall immunity that is needed, the herd immunity that is needed by the population.
All right, so just again, let's get that confirmation. You are going to recommend and urge healthcare workers to get it, not force them to get it, because that's a big worry. What if, and I ask this of you because I'm sure there are going to be healthcare workers that refuse the vaccine for one reason or another. What if they refuse the vaccine? What then? Will they still come to work? Will they still be able to work as they always have? Or what then?
We are confident that the majority of healthcare workers will be receiving this because they are looking forward. But there will be those who are refusing, not because of any other thing, but because they will not have been sure about the impact of the vaccine, but also being victims of the distortion that have been put there, particularly through social media. So it becomes our responsibility as the trade unions to do our best to convince them, because this is more about their lives, and they ought to be told the truth in terms of what is the meaning of the vaccine in their lives and their survival. So we'll have to do that, but we will also respect the individual decisions not to take it, but we are not going to give up. We'll continue to encourage and persuade them, but we can't force or impose them. But of course, there will be no worker who must refuse to go to work because it doesn't want to take the vaccine, because the vaccine is not imposed. It's a choice to be made. So we'll have to be running to that. As I was saying last time, the key And the secret for this is the kind of an educational awareness programs that we are driving to empower not only healthcare workers, but the society to recognize and appreciate the interventions that are made, that these interventions are more about saving their lives than to be killing them, because currently the COVID is killing them. And for them to survive it is to get immunity so that they can be strong.
All right, we leave it there. Zola, thanks very much for talking to us. We'll catch up with you again once, of course, that the vaccination process starts. So you heard from Zola that the vaccine has left Belgium, that it should be arriving here in South Africa perhaps today, and then by Friday they're hoping that there will be a rollout, and that's what we will be waiting for. So let's see what happens. We'll take it as, of course, and when it arrives in the country. 8:32. That's what time it is. Let's get your headlines now.